When you think of nursing, what comes to mind? Is it the hospital wards? Is it ICU? Is it trauma? Well, what if I told you that nursing goes far beyond this? In this new series, we'll be delving into the nursing specialties, and there's over 100. Some that you might know and some that might surprise you. From corporate nursing to dialysis nursing, from forensic nursing to research nursing, the opportunities are endless. So whether you're a student trying to figure out the career option that is best for you, or you're a nurse and you're trying to carve out a new path for you, this series will help you to discover where your passions lies. So to kick things off, we'll start with general nursing. This is a field that everyone knows, and we'll be delving much deeper into it, what it consists of, and if you're someone who is in a general nurse position, you can discover new options that are there for you. So without wasting much time, let us start. What is a general nurse? General nurses, or registered nurses as they are known in many countries, are the backbone of the healthcare system. They provide care to patients with a variety of medical conditions in different healthcare setups, from hospitals, clinics, community health centers, and even nursing homes. Their responsibility include administering medications and treatment prescribed by doctors, monitoring patient health and updating medical records, assisting with procedures and diagnostic tests, educating patients and families about managing illnesses or injuries. Essentially, they're the first point of contact for patients, and they play a critical role in ensuring their well-being. As a result, being a general nurse is the entry-level position that all nurses go through, and this is what is usually known as your Med-Surg ward. So your Med-Surg is your medical and your surgical patients. So in your medical wards, you usually have patients that are dealing with their chronic conditions and the treatment thereof. So patients with hypertension, diabetes, asthma, and all the different exacerbations of these illnesses.
We need to talk. I've seen so many comments that confuse chronic illness with terminal illness, so let me clear it up for you. Chronic illness is not the same as terminal illness. I'm not gonna die, I'm just gonna be sick for probably the rest of my life. A chronic illness is a health condition that doesn't go away and often needs ongoing care or management. Unlike a cold or a flu, which you usually recover from quickly, a chronic illness can last months, years, or even a lifetime. Chronic illness can affect daily life, like causing fatigue, pain, or other symptoms. And that they still do if the person doesn't look sick.
And these patients can either be in a long-term facility or a short-term, depending on the progress of their treatment. Or it can be in a surgical situation where it's patients that are going in and out because they go for the procedure, they recover, and they go home. So depending on your personality, some people prefer having patients that stay long-term. You get to know these patients and you get to educate them slowly about their condition. Or some people like a bit more fast-paced situation where the patient is in and out, and you don't see the same patient for more than a week, etc. And the amazing thing about these medical and surgical wards is that it can be very diverse. You can have a medical ward that is specifically for peds, specifically for adults, specifically for geriatric age. You can do the same with your surgical ward. And you can even diversify it even further. With your surgical wards, you can have a specific ward that is for a specific body system. For example, you can have your orthopedic surgery, which just deals with bones and any injuries thereof. Or you can have a GIT ward that just deals with stomach issues, abdominal pain, cramps, removal of gallbladders, appendix, etc. Or you can just have medical ward that is specifically for chronic conditions, and they can have one just for hypertension. I've seen other wards where just specifically for diabetes, or you can have a medical ward that is specifically for burn wounds. So I really don't like when people say, I don't like Med-Surg because it's boring, it's patients that are there for long term and things like that. Yes, some hospitals do not have the capacity to specialize in all these different wards, but that is not the end all of Med-Surg wards. These Med-Surg wards can be diversified a lot, and Red Cross is a really good case study for how this is done well. In a Red Cross hospital, it is a hospital specifically for children, and as a result, since it's just for children, they get to specialize in different wards. They have a trauma ward just for kids, then they have a GIT unit for patients that have come with diarrhea, lack of appetite, that sort of thing. Then you have wards just for infectious diseases, then you have a ward just for diabetes, then you also have a ward just for burns. So Red Cross allows you to be able to diversify, even though it is a medical surgical hospital, but it's specifically for pediatrics. But within those pediatrics, it is branching out a lot more. So I never want people to just think, oh, when you're thinking of medical surgical wards, it's just these long-term facilities. There is more within medical surgical, and you just have to find where your passion is. For example, with me, I love orthopedics. It's just interesting how the bones are put back together when patients goes for these operations, when you have to have traction. It's just a really fascinating ward to be in. And some people love GIT because you get to see how the stomach is functioning, and also in those type of wards you usually have a lot of wounds and stoma bags that you're dealing with, and people gravitate towards it. So depending on the body system that you love, you can honestly find a ward that just specializes on that. So comment down below and let me know which one is the favorite organ in the body. For me, definitely bones, but heart definitely comes a second close. So let me know down in the comment section. So for a person to become a general nurse, you need to either do a diploma in nursing or you can do a bachelor in nursing, and these will allow you to be able to graduate as a registered nurse. But depending on whether you do a diploma or a bachelor, that will affect your specialization in the future. So just have that at the back of your mind. But other one allows you to become a general nurse, and then after you become a general nurse, there's usually a licensing exam that you need to do for you to be registered with your professional bodies. And then as a result, you can choose whether you want to go for peds or you want to go for adults. Do you want to go for medical or you want to go for surgical, or do you want a combination of both? So according to the stats on Google, obviously how much you actually earn would depend on where you're located, the number of years of experience that you have, whether you're working in a private sector or a government sector, and also just depending on the location and your negotiation skills. In South Africa, where general nurses can earn between 20,000 to 35,000 rand a month. In the United States, you can earn $60,000 to $80,000 annually, and then in the United Kingdom, you can earn 25,000 to 35,000 pounds annually. Obviously, these figures can increase and decrease depending on your situation, but that is the general idea of how much these nurses can earn. So before I close off, I have an interesting question for you, and you can comment down below and let me know a reason for your answer. Do you think Florence Nightingale was a general nurse or was she a trauma nurse? I would like to hear your thoughts down below, and I'll also give you my answer down below. So there you have it, the first discipline in this series. Yes, it is the most basic, but the reason why I started with it is because it forms the foundation for all the other disciplines that I'm going to go into, so that even if you are a Med-Surg nurse at the moment, the experience that you're gaining working in this field will allow you to be able to filter into the other disciplines that I'm going to be discussing if you want to eventually transition into that. Or even if you're a student, you have to start with Med-Surg at some point, and as a result, this will help you to be able to know what you're getting yourself into and the different positions that you can enter into. So you can comment down below and let me know which discipline are you looking forward to hearing from me. So don't miss out the next episode next week Friday, 12 p.m. South African time. Have an awesome one. Bye guys.